Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is your chance to ask any questions that you have of me live, as well as my chance to answer any questions you guys have submitted onto the videos on the channel. Please remember to share the channel with your friends and family. Follow us over on Facebook and Instagram for additional content. Those will be linked. And remember, when you like and subscribe to the channel, you're really helping me out as a content creator. YouTube takes it very seriously when creators have subscribers like you, and it really helps me out. And for those of you guys who stay until the end, I'm going to give you a sneak peek at tomorrow's video. And so that's another reason for me to remind you to subscribe and hit the notification bell so you can be notified when our latest content comes out. I'm going to go ahead and I'm going to get started with some of the questions that you guys have asked onto the videos on the channel, and please feel free to put your stuff into the chat. So we're going to start out today actually with some questions that we got on the superfoods video that I have. I have a video on the best superfoods while you're pregnant. And so one of the things said, I cannot stand the smell of milk or the taste of yogurt. Would ice cream still be as good as dairy? Maybe too much sugar. I think that this is a great way to start this discussion off. So we all hear about, the joke about the woman who wants the pickles or the ice cream, right? We hear about those midnight runs for cravings that women have. But I'm actually going to tell you this question about whether ice cream could be substituted for yogurt or other forms of dairy is actually kind of sound. So when your body is craving something, your body's actually craving the nutrient. So again, the whole idea of ice cream, the body is probably not craving ice cream. It's craving the protein that's within the ice cream. But when we're craving something, because our body needs protein, our body's also going to send signals for us to eat something that will fulfill the nutritional need that's also yummy, okay? And in most of the world, we're addicted to sugar. So a very cool way to get dairy-based protein is with ice cream. So now when you're a pregnant woman who is craving a little bit of protein, your craving may turn into wanting ice cream. So in this case, if you can't eat yogurt or something else, ice cream is a potential option. However, the viewer did note the high sugar content of ice cream, and that cannot be ignored. Gestational diabetes can be extremely devastating to you and your baby, and so you want to avoid it. So if you are going to have ice cream, you can try to stick to different versions of ice cream. For example, nowadays, because of the keto diet, and I have a video on keto that you can look into, the ketogenic diet is a low carb diet. So now if you go into the freezer section at the store, you're going to find a whole bunch of keto friendly ice creams. And these are ice creams with a lower carbohydrate content. You can also find tons of recipes out there to make your own ice cream. So you can actually make an ice cream that's a lot more nutrient dense, meaning you can put stuff into that ice cream that gives it a lot higher nutritional value. So those are a couple ways to kind of go with that. Now, if you're talking about dill pickles, for example, which is the other, thing I mentioned, dill pickles, when women crave dill pickles, they're most likely actually looking for salt. We think of salt as this really terrible thing, but actually salt is needed for a lot of different things, including for keeping your blood pressure higher. While we always hear about high blood pressure, some people actually suffer from low blood pressure. So if your blood pressure is not high enough, you actually may need a little bit of salt, and that can kind of help. So that's actually one of the ways that if you're craving salt, your body might translate the craving for salt into something like dill pickles, which meets that requirement. Now, the other question I got on the pregnancy superfood was, is it a fried egg or boiled egg that is preferable during pregnancy? So when it comes to actually eggs as a superfood, either one is okay for pregnancy. Now, boiled eggs tend to hold on to the nutrients a little bit better, and you're not frying it in something else. So as long as you're not frying it in something else, you're also avoiding the oils. However, sometimes having a fried egg that's fried, say, in olive oil, so now you're getting the healthy fat from olive oil, and you're breaking down the proteins a little bit in the egg, but it can be easier to digest, and it may be easier on the stomach. So either way is actually okay. Ultimately, with eggs, it's about eating the egg. It's not about how you eat the egg, as long as you're not loading it up with sugar or fat from some other source. So that was a good question on that. So we had a question on my swelling video, and it was a good question. It said, I still have water retention after 1.5 years of my delivery, especially in my legs, some in my arms, but mostly in my legs. What should I do? So, swelling is extremely common during pregnancy and postpartum. There's a lot of different reasons why swelling can happen, but basically, a lot of it can happen because of inactivity. So, what'll happen is your legs during the pregnancy, you're not moving around as much, and so you end up with something called venous stasis. So that basically means that the veins in the legs, they stop working as well. And so what happens is all that fluid that's supposed to be traveling around your body all the time ends up just sitting in the legs, and it just kind of sits there. Now, one of the things you need to know, though, is that venous stasis is a sign that your cardiac system, your heart, and your blood vessels aren't working well. And it could be a sign of congestive heart failure. So if you're having excessive swelling and you don't have any other reasons for it, you want to go to a cardiologist. Cardiologists are heart doctors, and they're the ones that can look at your heart function to make sure that the heart itself is pumping okay. Because a young woman of childbearing age should not be having such dependent edema without something else going on. What can you do about swelling? Believe it or not, one of the best things you can do is to drink more fluid. So a lot of people, they get concerned that what's actually happening is that they're drinking too much, that they're too hydrated. So they stop drinking. But when you stop drinking fluid, you become dehydrated. And what your body does is your body holds on to fluid. So instead of getting rid of extra fluid, your body won't do that. It'll hold tight because it knows you're dehydrated. So you need to drink lots and lots of fluids if you are seeing a lot of swelling. You also want to exercise. Walking is the best form of exercise to kind of move those muscles. You can also do biking and other forms of exercise as long as it's been approved by your healthcare provider. And then finally, if you are having issues with your blood pressure, somebody who's having swelling in the legs wants to reduce their salt intake. So that's another, thing to know about. Okay, so that was a really good question. For those of you who are joining, welcome, welcome. Please feel free to put your questions into the chat. We got a couple questions related to bleeding, like we usually do this week. And we're going to start with placenta issues because we had several on the Placenta Previa video. So the first one said, there's no bleeding right now, and we need to travel 500 kilometers by car. Is it necessary to travel? It is not a bumpy road. And I think what they're asking is it okay to travel with a placenta previa? The next one said, I was diagnosed with placenta previa at 20 weeks, and I'm now 33 weeks pregnant with the same situation. I do not have any bleeding, and I've had one pregnancy with a normal delivery. I am scared. Will I have a hysterectomy after my C-section? What are the chances? Please reply. I am worried. And the third one said, I am 12 weeks pregnant. In my FTS, I learned I have a central placenta previa. I also had a subchorionic hemorrhage since week 7, which is now reduced to a moderate size after medication and 6 weeks of bed rest. What can happen next? So these are 3 great questions to kind of highlight the placenta previa. So placenta previa, here we go. We have our uterus, and at the bottom of our uterus is a cervix, okay? Perfect representation of a cervix. You've got a long, thick, and it's closed, okay? And the cervix, when it's closed, this is actually kind of what it looks like. And in this line right here, this is where the mucus plug sits. So as your cervix dilates, that's how the mucus plug comes out. Okay. So the mucus plug blocks this up so that no bacteria can go up into your cervix. Okay. So we're back here. This is our cervix, and sorry, into your uterus. So you have your cervix, and this is a placenta covered with blood vessels. So we have 3 types of kind of placental positions when it comes to like previa. Okay, so you have complete. This means it's full on straight over the cervix. There's absolutely no question about it. It's completely blocking it. Okay, this is probably what our second question, the 33-weeker, is referring to, and the central placenta previa comment. It's called a complete placenta previa. When somebody has a complete placenta previa, they are going to be having an automatic C-section. There is no way around it. And we usually do it early, sometimes between 34 and 36 weeks of age. Now, here's why. Remember I said the cervix, when it dilates, it opens like this, right? Well, if you have a placenta that's all covered with blood vessels here, and it's sitting straight on top, and this dilates, all these blood vessels are now open, and they just bleed and bleed and bleed. And it can cause a life-threatening hemorrhage for both mom and baby. And this is why we need to do a C-section automatically if you have a complete placenta previa. Now, secondary is a partial placenta previa. So you have your cervix and you have your placenta. Instead of being central, it's kind of off to the side. This is also usually a C-section because, again, if enough of it's exposed and you dilate, you're going to bleed out, and this is a medical emergency. And then we have a low-lying or marginal. So this is a placenta that's sitting right next to it, okay? And oftentimes with these guys, we will allow a mom to deliver naturally, but there's a lot of heavy monitoring. And for example, this is not a mom who's going to be able to deliver in a birth center because we need to be able to do a quick emergency C-section if necessary. But this is a placenta that sits right on the edge. Now, for our 12-weeker, sometimes you start out with a complete placenta previa, but then as time goes on, the placenta migrates or moves up the side of the wall away from your cervix. That is considered normal. And that's simply because when your uterus starts, it's like teeny, teeny, tiny. And by the time you're getting ready to deliver, that uterus has expanded to hold a big, giant baby. So the placenta has a long way to grow and to move. And so it will often shift upright. Now, if you have a placenta that's completely covering the cervix, when you're talking about somebody who needs to take a car ride, we usually don't recommend long travel. And I will tell you, I personally think that after 5 or 6 months pregnant, you shouldn't go anywhere. I have taken care of so many women in the hospital that were hours, days, like from their hours away from their houses, or days, meaning like 2 or 3 days of car travel away from where they live. I've taken care of women that came to South Florida. I live in South Florida, so it's a vacation destination for a baby moon or a baby vacation before they had their baby, and they weren't able to go back to their country because they went into preterm labor. So you always want to be careful when you're trying to do any kind of travel and you're pregnant. And if you have a placenta that's sitting right here, even if the road is not bumpy, sitting in a car for a long period of time can do a lot of things to the body, and it could cause some kind of preterm labor. And if you're bleeding, that could be a medical emergency. So now when it comes to a hysterectomy, so forget about a placenta previa, okay? When you have your placenta, it's covered with blood vessels and it adheres to the side of the uterine wall, which is also covered with blood vessels. And what happens is these two connect and they form a bed that feeds the baby. It brings nutrients and oxygen and blood to the baby, and it takes away the carbon dioxide and all that other stuff away from the baby, right? Okay, so this is here. Once your baby has been born and the cord is cut, there's some hormonal processes that take place that kind of say to your body, hey, you just had a baby. And once that happens, your body is designed to deliver the placenta. So this means your uterus is going to contract and the placenta is going to try to come off the uterine wall. Most of the time it comes off on its own. Occasionally we need to give it a little bit of assistance. Now, when you have a placenta that is sitting over the cervix and you're having, say, a C-section, it's still going to detach. We take it off. We just take it off manually. So there's no need to automatically have a hysterectomy just because you have a placenta previa. Placentas are supposed to come out of your uterus. There is a certain type of placenta issue. It's placenta increta, accreta, and percreta. And this is where the placenta basically grows into. So instead of being on the top of the wall, the placenta grows into and through and sometimes into the body. Okay. And so this type of placental presentation is very often associated with having an automatic hysterectomy because there's no way to separate the uterus from the placenta. Therefore, you end up just needing to have a hysterectomy to save your life. But I don't think that there's an automatic reason unless there's something else going on with your health history. For those of you who are joining us, please feel free to put your questions into the chat, okay? Going along with bleeding, I had a question from a viewer that said, my wife is currently 2.5 months pregnant. Heavy bleeding has occurred within the past week. She is APLA positive. So APLA is antiphospholipid syndrome autoimmune. And this is a condition that can cause a whole bunch of bleeding issues. Most of the time, it's blood clots. So this person's body, any autoimmune disease is attacking your body. And with antiphospholipid syndrome, you end up having this condition where you throw a lot of blood clots. And so as a result, women with antiphospholipid syndrome often have a lot of miscarriages. You can also have bleeding because the platelets don't form correctly. Platelets are a part of your blood that helps your blood clot, so you stop bleeding when you get cut. So the platelets don't form and work properly. So you also, not only do you have clotting, but you also have bleeding. And so I think that that's probably what's happening, unfortunately, with this viewer's wife. And it's really a shame. In this case, if you were to have some kind of condition like that and you knew ahead of time, you want to make sure you're working with a maternal fetal medicine physician. Maternal fetal medicine physicians are the ones who have the latest research and information on conditions like antiphospholipid syndrome. If you are a family who's experienced a lot of miscarriages, one of the things you should do if you're getting any kind of genetic testing is to actually test for antiphospholipid syndrome. This is actually a condition that may lead to repeated miscarriages. So this is something that you definitely need to get checked out because it's probably the APLA that's causing the issue. We had a question, and it said, I'm pregnant and I've seen blood for 3 weeks now. I started bleeding at 4 weeks and I tested it today and it was positive. So I'm confused. So when we are, believe it or not, it's a way more common. And if you start talking about your friends, you're going to find that your friends and stuff will also say to you like, oh yeah, I had bleeding. Oh yeah, this, all that stuff. And it's really amazing how many women experience it. It can be caused by sex when the vaginas, like the vaginal walls are too thin. And that's because of the hormones for a healthy pregnancy. They thin out the vaginal walls. So you can get some kind of stuff for that. You also may find it because, you're having stuff like different types of infections, urinary tract infections, yeast infections, and the like. And then we can have our normal menstrual cycle, which can cause this kind of thing. So ultimately, if you see bleeding, you should not necessarily assume that you are having a miscarriage. And it is not necessarily unexpected to see a positive result. However, with miscarriage, it's tricky. We're testing for human chorionic gonadotropin. That's the hormone HCG that tells us if you're pregnant or not. When you're peeing on the little home pregnancy test like the kits, that just looks for any. So it's just a positive or a negative, and that's it. It's just looking for any at all. But when you're using, so that if you're in the middle of a miscarriage, unfortunately, you could still test positive. The only way to know for sure when we're talking about HCG levels is to have your blood drawn. You have your blood drawn, and then 3 days later, you have your blood drawn again. And we check the HCG level pre and then post, and we compare those two, and it should be rising. If it is rising, that means that you're most likely having a successful pregnancy. However, if the level is not rising or it's falling, that's usually a sign of a miscarriage. So if you are suspecting something, you want to make sure you go and get it checked out, because that way they can do the right test to tell you what's going on. And we have a video about what to ask if you go to the emergency room to get checked out that we can link into the description. So we had that previous question that talked about the placenta previa with the subchorionic hemorrhage, and we have another one just on the subchorionic hemorrhage video that said, how long can the bleeding last? So let's talk about a subchorionic hemorrhage. So subchorionic hemorrhage, so you have a placenta, it's all these blood vessels, and it attaches. Now, what a subchorionic hemorrhage is, simply a pooling of blood underneath this placenta. So if you've ever like hit your arm and you've gotten a bruise on your arm where you see that like circular purple patch, that's actually broken blood vessels under your skin. And at first it may look big, and then over time it gets lighter and lighter and smaller and smaller. That's pretty much how to imagine a subchorionic hemorrhage. It's like a whole bunch of broken blood vessels underneath the placenta. Okay. And over time it gets smaller and smaller and smaller, and it just goes away. And what also happens is at the same time, the placenta is getting bigger and bigger and bigger. So even if it's staying kind of the same in size, it's still getting smaller because the placenta is getting bigger. Sometimes we find them on ultrasound. If we find it on ultrasound, guys, it's usually hardly even an issue at all. Sometimes we find it because you're bleeding, so we do an ultrasound, and that's how we see it. But you may not bleed at all from a subchorionic hemorrhage. You could bleed for a couple days and then stop, and then bleed again. You could bleed once, not bleed for 2 months, and then bleed for 4 weeks. You got my drift? It's like variable. There's no way to predict them. So the only thing you can do is to always report to your doctor whenever you're suspecting you're bleeding so they can do an ultrasound. Here's the other thing, and this is the scarier part of a subchorionic hemorrhage, okay? The scarier part is when you're, say, in 8 to 12 weeks pregnant, you start bleeding a little bit. So you go in and you get the ultrasound, and they're like, oh, you're bleeding because you have a subchorionic hemorrhage. So you bleed for a little while, baby's fine, you do fine, everything is good. And then you stop bleeding, and then you start bleeding again, and you don't tell anybody. And that second bleeding had nothing to do with the subchorionic hemorrhage. That's the scariest one. So this is something that happens, and people won't say anything because they thought it was still the subchorionic hemorrhage. Never hesitate to report your symptoms, ever. Your healthcare providers have signed up for a 24/7 job. That's what they signed up for. So you have them as a resource. Call them if you need them. Go to the hospital if you need to get checked out. Don't just assume that because you saw bleeding yesterday that today's bleeding is the same thing. You want to make sure every questions you're getting answers, you're making sure you're getting assessed. That's how you keep yourself and your baby safe and healthy. For those of you who are joining me, welcome. I'm Dr. Samantha. I'm answering some of the questions you guys submitted onto the videos this week. Please put any of your questions into the chat. And for those of you who stick around till the end, I'm going to go ahead and give you a sneak peek at next week's video. All right, so let's start working on antibiotics. So we get a lot of questions on infection, and I think infection is extremely important for us to address because infection is one of the leading causes of preterm labor and preterm birth, and it can, for a variety of reasons. It can affect mom, and then mom can't be pregnant anymore because she's going septic, which is a blood infection, or it can affect baby because the baby's getting all the symptoms because the bacteria like passes across the placenta. So the first question was, I'm 28 weeks pregnant. My urine culture shows E. coli bacteria, but I have no symptoms, no itching, no sensation. My doctor gave me amoxicillin tablets, 625 milligrams. After starting this medication, I had loose motions twice in one day. Should I continue the medication or stop? The other question I had from a different viewer is having headaches a side effect as well? So, it is very common for you to actually get diarrhea when you're using an antibiotic. Antibiotics kill off good bacteria and they kill off bad bacteria. So our stomachs are actually colonized with a whole bunch of good bacteria, and that good bacteria helps us to digest our food and absorb our nutrients. So when we take an antibiotic, unfortunately, it kills off some of that. And as a result, you end up sometimes getting diarrhea because now your gut is out of balance. One of the things you can do is you can actually take a probiotic. Probiotics are fantastic for helping you to maintain your gut flora so that you don't get diarrhea when you're taking an antibiotic. As far as headaches go, pretty much any medication can give you headaches. Like it's almost seen on 100% of the labels. It's just some people are more sensitive to medications than others. So a headache, unfortunately, yes, could be seen. And that I would consider to be, normal. Hi, Michael Jordan. So how about protein drinks, pre-made ones and protein powders? I know they're high in protein, but are they safe when you don't feel like eating chicken, meats, and are eggs safe to eat every day? So, protein powders and drinks. If you can't eat or drink anything else, absolutely please have at it. However, protein powders are not ideal, and a lot of people reach for those thinking that that's like a great way to go. They are usually full of a whole bunch of other stuff. They usually have a lot of different minerals and vitamins, and not all of them are actually needed, and you have to be careful with the amounts. And I'm going to elaborate a little bit more on that maybe later, but ultimately they're pre-made, and so they're just kind of a one shot fix for all, and it doesn't always work. However, eggs are great. Eggs are a fantastic form of protein. Long time ago, there was some studies that related eggs to being bad because of cholesterol. And this misinformation has kind of translated forth to this day. So there's a whole bunch of different forms of cholesterol. If any of you guys have ever had your cholesterol drawn, we now do a lipid panel. So you have the total cholesterol, you have high density lipoprotein, HDL, low density lipoprotein, LDL, and oh my gosh, there's another one and I'm totally blanking and I'll remember in a minute. So all of these different types of cholesterol are important, and they all exist in different types of foods. Triglycerides, I told you I'd remember it. And one of the things you need to know is that the high density cholesterol, that's really important for you. The cell walls, your cell walls, every single part of your body is made up of a cell, and the cell walls, the things that make us not mush, are made up of cholesterol. That is right. You have to have cholesterol. The important thing is to have the right cholesterol, and eggs have the right cholesterol. The other really important thing that eggs have is choline, which is extremely important for you and the growth of your baby, as well as a wide variety of other nutrients. Now, what other people don't realize, so Michael Jordan, I don't know if you knew this, but one of the other things that's very high in protein, for example, is peas, green peas. So I urge anyone who is not able to eat certain traditional types of protein when they're pregnant. So if you're a meat eater, but you can't tolerate the meat, some people get really bad morning sickness with it. Look at a vegetarian's diet. Vegetarians, they have to eat protein just like a meat eater. So they are finding protein in different places. Now, we don't want to eat too much soy. Soy affects your estrogen levels. So you want to be careful with that, although in moderation, it's fine. There's a whole bunch of dairy products that some vegans will include in their diets, especially if they do any type of milk. But also we have the eggs, but you have nuts. Nuts is another great form of protein. But if you look at peas, pea powder is actually a form of powder that's oftentimes used. So I hope that answered your question. So I have a question that came across that was on the hemorrhoid video, and it was interesting, and it said, can IVF treatments cause hemorrhoids? So IVF treatment don't necessarily cause hemorrhoids. Hemorrhoids are basically the enlargement of a blood vessel in the anus that will actually swell and bulge because it's gotten too big. And so hemorrhoids can be caused if you've got a lot of constipation and you're straining to go to the bathroom, if you sit a lot, and other things. The IVF treatments, there's no reason that they should in particular cause hemorrhoids. But there is a lot, depending on where you are in your IVF journey, and anybody who's done IVF will tell you this, there is a lot of procedures and ultrasounds and other things that happen. And it is possible that all of that might be potentially weakening some of those vessels so that they end up forming a hemorrhoid. But there's no particular reason why IVF should do that. I had a question on preterm labor, and it said, I'm 31 weeks pregnant, and this is my first pregnancy. My breasts have started leaking, and I'm starting to have mild cramps and pain in my lower back. Is this a sign of labor? So 31 weeks pregnant. When we are about halfway through our pregnancy, so about 20 weeks, you are going to start to develop colostrum. Colostrum is the first milk that the baby is designed to eat. It's very thick and it's full of all the nutrients a brand new baby needs. That colostrum for many women will start to leak out. And actually, one of the most common times it will leak out is when a woman is having sex. So if you're having good sex and you have an orgasm, when you have that orgasm, your body releases the hormone oxytocin. Oxytocin is the milk ejection hormone. So it's the hormone that tells your breast down their milk. So when you are making milk, whether it's colostrum or a full milk supply, when you have an orgasm, milk may start squirting out of your breasts. And this is why sometimes after you have the baby, you need to wear a bra during like sex or something because of that. So when you are earlier into your pregnancy, 20 to 30 weeks, you may start leaking the milk because it's there. And if you're during sexual contact, it can happen. So the milk part is normal for 31 weeks gestation. However, if you're having any kind of bleeding or cramping or pain, you definitely need to go get checked out. Cramping and lower back pain are signs of preterm labor, 100%. And so often it's caused by dehydration. We see so much dehydration during pregnancy. And if you get to us fast enough, we can just give you some IV fluids and you're on your way back out. But if you wait too long, your cervix is going to dilate and then you're going to need to have the baby or be hospitalized. So yes, you want to get checked out at that. That's definitely the starting point of preterm labor. Okay. Now, we had a couple questions we had a question on my bottle feeding video. Many of you guys may know that I'm a lactation consultant. I'm definitely pro breastfeeding, but I'm also pro formula feeding and pro bottle feeding. So not direct breastfeeding, but maybe breast milk in a bottle. And so I have some videos on that. And it said, would this, it was on the PACE bottle feeding video. And it said, would this method be help a baby with a recessed jaw? My baby had a frenectomy at 6 weeks. She's now 4 months old, but she is still Always clicking and gassy. I've noticed her jaw is recessed, so I'm wondering if this is a problem and if this is a way of feeding that will help. So, for those of you guys who aren't sure what she's talking about, a recessed jaw means the jaw is set back. It's like further back, okay? So, a recessed jaw can be present for a variety of different reasons. Sometimes it's just people's natural jawline. Sometimes it's a result of certain types of different syndromes and different things. So, paced bottle feeding might or might not help a baby like this, but feeding babies with a bottle, a lot of babies have a lot of feeding issues with bottles. So, what you want to do is you actually want to ask to be evaluated by a speech therapist. So, speech therapists at their core are actually infant speeding specialists. That's where they start their training. And a lot of people don't realize this because they just think that what a speech therapist does is to teach people how to speak or how to pronounce. But in order to understand how to pronounce a word, you have to understand the structures of the mouth and how the mouth and the tongue work together to make sounds, etc. It also involves swallowing. And so speech therapists are also usually trained to feed kids. In most neonatal intensive care units, NICUs, you'll find speech therapists are feeding babies. That's part of your baby's care in a NICU, is to be seen by a speech therapist. So for somebody whose baby is having trouble and has a recessed jaw and has had a tongue tie, a feeding specialist is actually best because a feeding specialist can help. Now, as far as paced bottle feeding, if your baby is actually not really able to eat fast enough, paced bottle feeding is probably not going to be a good idea for that type of baby. Okay. That type of baby is going to have a lot of trouble potentially. And if they can't create the right intraoral suction, then they're not going to be able to, to be able to take the formula in or I should say breast milk or whatever, and do what they need to do. Nicole, I am so sorry to hear that. Oh my goodness. I really am so sorry to hear that. I hope you're feeling well, and I hope that you're, meaning physically well. I apologize, but I hope that your body is able to recover right now. Please let me know if there's, anything that I can answer, any questions or anything. I'm going to go ahead and I'm going to answer the next questions that I have. Okay. And it's, we're going to go to yeast infections. Okay. We had a couple questions on yeast infections, and it was about, one of them said, I'm 29 weeks pregnant and my doctor prescribed fluconazole. I did some research before taking that drug. Should I take it or not? Another one said, I faced an infection after using flurazone medicine. More green discharge is coming out of my vagina. Is this normal? I'm 7 months pregnant. So these are two really good questions to kind of start. So we had yeast infections is extremely important to get them treated because you want to make sure that you're preventing infection because it can lead to complications during a pregnancy. And so it's extremely important to treat all infections. Fluconazole is one of the medications that's commonly, it's also called diflucan. And if you Google diflucan, you're going to see a lot of things out there that tell you that it's not safe for pregnancy. And hold on a second. So one of the things I want you guys to know is that I am feeling very sympathetic for Nicole. And one of the things that I do in my line of work is I talk to people who've lost their babies. And it is extremely hard, even doing what I do, to say the right thing and know the right thing to say. And so I want you guys, if you ever know a friend, a family member, a neighbor who has had a miscarriage, if you don't have the right words, you always tell them that. And so like Nicole right now, when I'm answering these questions, please understand that the awkwardness, I'm awkward for all my other viewers because I don't want to make Nicole feel bad with any of my answers. And Nicole, I really wish I had the right words to say. I'm very sorry for your loss. And I wanted to stop and say this because I genuinely feel that way, but I also feel it's important for you guys to see that it's okay to be awkward with your words and to just tell somebody you don't always have the right words and ask them what they need. So, sorry, I had to do that because that's who I am. So, fluconazole. It is safe for use for a yeast infection during pregnancy as long as that it is at lower doses. So diflucan at higher doses is actually potentially hazardous for your pregnancy. So higher doses are like 400 to 800 milligrams. Oftentimes we use it at much lower doses. We'll use it at like 150 milligrams and we'll do it for like 1 or 2 days. And that's okay. And in fact, it's extremely, extremely effective and it can get rid of that yeast infection very, very quickly. So I encourage you that if this is something that you've been given, you want to go ahead and take that. Untreated yeast infections can lead to a uterine infection, which can cause miscarriage, stillbirth, and preterm birth. So we want to get it taken care of. It can also accelerate to a bacterial infection, which a green discharge is usually indicative of a bacterial infection. So that's one that's going to require antibiotics. One of the things that was mentioned in the second question was the medication flurazone. And I actually have a different video. It's on my UTI video. And it said, I'm 33 weeks pregnant. I have a UTI. My doctor suggested that I take 2 milligrams. Is this okay to take? So flurazone and Taxim O. These are not medications that I am familiar with. They're not medications that I actually use or have seen used. So what do you guys do if you need further support? If you're not sure what is going on, and if you're not sure if what they've given you is safe, what you want to do then is you want to go ahead and you can talk to your pharmacist. So pharmacists are also trained and have specialized training in the medications that are safe for women who are pregnant and postpartum. So these are another set of resources for you to go and to ask your questions and to see, are the risk benefits worth it for that medication, okay? And this is something that I stress a lot because it is okay if you're questioning what your healthcare provider is offering to you, as long as you are making a timely decision and having good counsel. And so a pharmacist would be another one to go ahead and look at that with. I had a question on the drying up milk video. So it said, I just gave birth a couple days ago and I wanted to breastfeed, but can't because of the stress. So now I'm using formula, but the milk has started to come in and I don't want to get mastitis. What should I do? Okay. So drying up milk is a very, very, it can be a very challenging problem because it's oftentimes very difficult to do. For starters, the one thing I'm going to tell you guys is do not use cabergoline, which is also called bromocriptine. This is a prescription medication that is oftentimes given out by OBGYNs who don't realize the catastrophic effects that this medication can have. Bromocriptine, also known as cabergoline, it actually works really well. And when you're taking it for a couple days, you're going to feel really good, like emotionally really good, because it boosts up dopamine. But then you can only take it for, I think it's 10 or 14 days, and then you have to stop. And when you stop, all that dopamine goes away. And what follows is this huge crash that can cause postpartum depression. So it is extremely detrimental to your mental health. So instead, for drying up milk, you want to try to use certain herbs like sage tea. You can also use, oh my gosh, I'm losing I'm sorry, you can also use Sudafed and Benadryl. So these are the medications that you use for allergies to dry up your like sinuses and stuff. That can also dry up your breast milk. Peppermint tea is great. You can also get essential oils, peppermint essential oils, and you can put them on the breasts. You want to try a little piece of your skin just to make sure you don't have an allergic reaction. And you also don't want to make sure your baby doesn't touch the peppermint like oil, because it can actually give the baby like an allergic reaction also. You want to make sure you're wearing a firm bra, lots of ice. Cabbage leaves actually work. That's a real thing. And then you can do Tylenol and stuff for some of the pain. So those are some of the things that you can do. And that's the only thing you can do. Just don't use cabergoline. Hi, I'm 13 weeks pregnant and my baby is 1.1 millimeters and the nasal bone route is seen only. Doctor suggested follow-up scan, double marker shows low risk. How can I proceed? I'm worried about the baby. Oh, the NT is 1.1. So right now, what's going on is that her ultrasound is showing slightly abnormal. So at 13 weeks pregnant, you're still a little bit early that some of the stuff there might not be quite fully visual yet. Unfortunately, ultrasound, it's like good, but ultrasounds aren't great either, but there's no other technology that we have right now. So they should be asking to repeat that ultrasound by 15 to 16 weeks. That's the only thing they can do right now. If you show low risk, they could also do the genetic testing through your blood, but really it just has to be repeated. There's no vitamins or anything. If there's any kind of structural abnormality, there's nothing that you're going to be able to take. So I would just make sure you're getting that follow-up ultrasound to see if everything is looking good or not. They should be sending you also to a high-risk physician if this isn't already a high-risk physician. And the high-risk physician, even though you're a low-risk marker, should be able to look at the ultrasound better. Your regular OBGYNs, they see ultrasounds, but they don't often see abnormalities on ultrasounds. There's these doctors called radiologists who read x-rays and CT scans and MRIs and all that stuff. They also look at all sorts of images all day long. But a maternal fetal medicine physician, which is the high risk pregnancy doctors, all they do all day long is look at ultrasounds of babies. So they're really good at reading them and they're really good at understanding what they're looking at. So that would be who you'd want to follow up with. We had a couple questions on twin deliveries this week. One of them said, my HCG level at the 4th week is 513. Am I pregnant with twins? And the other one said, I'm having die twins. I'm 32 weeks, hoping for a vaginal delivery. I had 3 daughters naturally, and my 4th daughter was an emergency C-section. I'm hoping to deliver my twins naturally. It was 3.5 years ago since my C-section. What are your opinions about going for a vaginal birth? They said my scar could open up. So, let's talk about this. The HCG level, which we talked a little bit earlier about, there's 513 doesn't sound like a twin pregnancy, but honestly, you need more levels than that to even confirm that. So that's really variable. And unfortunately, I really can't answer that question very well. As far as having a C-section or having twins vaginally after a C-section, frankly, this actually should look like any other vaginal delivery, also called a VBAC, but a vaginal birth after cesarean section. I think we have a video on that we can link in the description. But basically, with any vaginal birth after cesarean section, there's a risk that the incision, the cut, the scar might open up. Now, they're not talking about the outside. They're talking about your uterus. So you need to know what kind of uterine incision you had. So on your belly, you might have a bikini cut, and we have a video on like C-section scars and cuts and stuff that we can link in there. So that bikini cut is that low, straight across cut so that you can wear a bikini later on. but that's just the outside. The uterine incision, that's the actual cut on your uterus. That is the one that is more important. And sometimes the outside will be across, but the inside will be up and down. If you have an up and down, that's called a classical. That is not a mom who should have a VBAC. Now, when you're doing a vaginal birth after cesarean section, what we've decided is that your risks are your risk benefit is such that we can try it. Twin deliveries technically are a little bit higher risk. So it will depend, and we have a video on twin delivery. It will depend on the position of the babies, because are they both head down? Do you have them side to side, etc.? But I don't see any reason why you couldn't try it. And here's why. You will be delivering in an operating room anyway. For those of you who are not aware, twin deliveries, twin births happen in an operating room, even if they are vaginal. Unless you're in a birthing center or something like that, in most hospitals, the twins are delivered in an operating room just in case we need to do an emergency C-section after the first baby delivers. So given that you would already be in an operating room anyway, my thought would be make sure you get an epidural so that that's in place. And if the other risks are not there, I would go ahead and try it. But you have to talk to your healthcare provider about it because they need to be comfortable with it. We had a question on the membrane sweep video. It said, how accurate is a membrane sweep in inducing labor? So unfortunately, there's no way to know how accurate it is. So we have a uterus, and inside the uterus is the amniotic sac. And the amniotic sac over time, it develops, it kind of adheres to the side of the uterus, right? The amniotic sac is that balloon of fluid your baby is in. And so a membrane sweep, what they do is they go up the cervix and then they take their finger and they try to basically loosen up that adhesion. So it hurts. And that's one thing they don't tell you. They'll say it's uncomfortable. It hurts. And so I want to say that to people because they often get very upset afterwards or feel like they've even been assaulted because they didn't realize how uncomfortable it could be. They're basically trying to rip the balloon off the side of the uterine wall. It's not fun. If they are successful, and you heard that, because sometimes they don't get quite in there the way they need to. If they are successful, that can release prostaglandins, which is a type of hormone that when your body gets that signal, it assumes that you're in labor and it will go ahead and start contractions. But that can happen anywhere from 12 hours afterwards to 4 days afterwards. And sometimes your body just doesn't get the right signal. So there's no way to know when it's going to start. I had a question on depression. Hold on, I'm just looking to see. I had a question on the labor video. I'm 38 weeks pregnant. My due date is June 21st. She's probably already had her baby by now. And I had thick mucus 2 to 3 days ago. Is this normal? Yes, that sounds like the mucus plug that's dropping out. Remember what I said, guys. You've got your cervix. The mucus plug is in here. When you dilate, it comes out. The last question I have for tonight is on the depression and anxiety, depression medication video. And the question was escitalopram, question mark. Escitalopram 20 milligrams, question mark. So escitalopram is Lexapro. Lexapro is an SSRI. It's a serotonin selective reuptake inhibitor, SSRI. It helps to boost serotonin, which can help treat anxiety and depression. Lexapro is one of many antidepressants that we do use during pregnancy, and they are considered safe for pregnancy. Untreated anxiety and depression can lead to catastrophic effects during your pregnancy. And so it's very important to get treated, and that can help reduce your risks. So Lexapro is one of the ones that we use all the time. So with that, for those of you who waited until the end, thank you so much for being here. Your sneak peek at tomorrow's video. Tomorrow, we are releasing a video on prenatal vitamins and what you need to look for in your prenatal vitamin and why these particular nutrients are so important. To circle back to Michael Jordan's particular question, Michael Jordan's question mentioned the protein powders, which I said had a whole bunch of other things in them, different nutrients and minerals. And in my video, I talk about, for example, some of them you have to be careful because you can actually have too much and you can end up causing birth defects from having too much of certain vitamins. Not having too much of some vitamins is actually bad for you. So that video will talk about prenatal vitamins tomorrow. I'm Dr. Samantha, the maternity mentor. Thank you for joining me again. Thank you so much for your support. Right before I got online, I think we were like 20 viewers away from being at 31,000. So please feel free to share this with your friends and family and tell them to hit the like and subscribe button. With all your support, I am now a part of the YouTube health platform. That is an area of YouTube where they verify the providers to make sure that I am actually a licensed provider. I actually got real education and my content is sound. And so because of all of your support and love, we are now part of YouTube Health. Share the video, share the channel with your friends and family. Follow us on Facebook and Instagram for additional content. Just remember, we appreciate all of your support. Nicole, I'm sending you love and light and healing thoughts. Please make sure you love one another. I am so happy you are here with me tonight. Have a great one. I'll talk to you all next week. Bye.